Welcome to The Explainer. Today, we're diving into the anatomy of an absolute disaster. We're looking at one of the most devastating man-made environmental and public health catastrophes in U.S. history, the Flint water crisis. This is a documentary-level tragedy about governance, science, and the very real human cost of ignoring a community's cries for help. We're going to break down exactly how a simple cost-saving measure ended up poisoning an entire city. Okay, let's look at our roadmap for today. We'll cover how the disaster began, the actual science of the crisis, the human cost, the economic fallout, and finally, the resolution and the lessons we need to take away. Let's dive right in. Part 1, the disaster begins. So, to understand how a modern American city literally loses its safe drinking water, we have to go back to 2014. Flint, which is a mid-sized industrial city over in eastern central Michigan, was under severe financial receivership. Basically, local democratic processes were bypassed, and an appointed emergency manager made a fateful cost-saving decision about the city's primary waterway, the Flint River. You see, for decades, Flint had actually purchased treated, highly safe municipal water from Detroit, sourced from Lake Huron. But to save some money while a new pipeline was being built, officials decided to temporarily make the Flint River their primary water supply. And on April 25, 2014, they just flipped the switch. Here's the catch. That Detroit water, it was safe, it was treated, and it was chemically stable. The Flint River water, on the other hand, was highly corrosive, had a history of industrial contamination, and was just packed with chlorides and organic matter. Right after the switch, residents started reporting that their tap water was coming out brown, yellow, and foul-smelling. People were getting skin rashes and losing their hair. Yet for 18 agonizing months, authorities completely dismissed these complaints, insisting the water was perfectly fine. Moving on to Part 2, the science of the crisis. This wasn't just a bad administrative decision. It was a cascading, textbook engineering failure. First off, authorities failed to add corrosion control chemicals like orthophosphate to the river water. It's a standard practice, but they skipped it. Without that treatment, the highly corrosive river water actively ate away at the protective scale inside the city's aging pipes. This allowed heavy metals, specifically toxic lead, to leach directly into the drinking water. And to make matters worse, all that extreme corrosion of the iron pipes completely wiped out the free chlorine in the system, destroying the water's ability to disinfect itself. And when you lose chlorine in a water system, you basically open the front door to a biological nightmare. Enter Legionella pneumophila. Because the chlorine was depleted and the water was warm and full of iron sediment, which acts like food for bacteria, this airborne threat multiplied like crazy inside the pipelines. When infected water droplets are inhaled, say from just taking a normal shower, it causes a severe, life-threatening form of pneumonia. So faced with this sudden bacterial threat, water treatment officials panicked. They tried to fix it by overloading the system with massive amounts of chlorine. But actually, when you pump excess chlorine into organic-rich river water, it triggers a third layer of pollution. It creates what are called total trihalomethanes, or TTHMs. These are highly dangerous, cancer-causing disinfection byproducts. So residents were now dealing with toxic lead, deadly bacteria, and carcinogenic chemicals all pouring out of their taps at the same time. Part 3, the human cost. When we look at the actual human devastation, it really breaks down into 3 categories: liquid, gas, and scale. The liquid impact was the severe lead contamination. Just to put this in perspective, the EPA's action limit for lead is 15 parts per billion. In Flint, extreme cases were hitting an unimaginable 13,000 parts per billion. Then you have the gas impact, which brought the deadly airborne Legionnaire's disease spreading through steam and mist. And the scale impact? Well, this poisoned an entire city, affecting over 100,000 residents and completely shattering their trust in the government. The numbers here are just haunting. 90. That is the number of confirmed clinical cases of Legionnaire's disease directly tied to this specific water system failure between 2014 and 2015. And officially, the death toll from that outbreak stands at 12 lives lost. However, independent epidemiological studies suggest the true cost is much, much darker. Because of a lack of early laboratory testing, researchers actually estimate there were over 112 uncounted pneumonia-related deaths during this period that have strong links to the contaminated water. But honestly, perhaps the most horrifying statistic of all is this: a 58% increase in fetal deaths. Lead is an incredibly potent neurotoxin. When pregnant mothers drank the water, the lead in their blood easily crossed the placental barrier. It disrupted cellular division, starved fetuses of oxygen, and led to a tragic spike in miscarriages. On top of that, the overall fertility rate in Flint dropped by 12%, just because heavy metal toxicity disrupts reproductive systems so severely. Part 4, the economic fallout. When governments try to cut corners on public health to save a buck, the long-term financial devastation is just catastrophic. In Flint, property values plummeted, leaving families totally trapped in homes they couldn't sell. The state's attempt to save a tiny fraction of its budget resulted in them having to spend millions upon millions of dollars to physically tear out and replace thousands of corroded lead pipes. Plus, they are paying massive healthcare compensation costs to victims. And for years, they had to bear the astronomical logistical cost of providing bottled water and filtration systems to an entire city. Part 5, resolution and lessons. So how does a city even begin to recover from something like this? Well, after independent researchers finally exposed the reality and states of emergency were declared, action was taken. Step 1. They immediately switched back to the safer Detroit water supply. Step 2. A massive emergency distribution of filters and bottled water. Step 3. They started treating the system with orthophosphate to rebuild that protective pipe scale. And step 4. The grueling, years-long process of digging up and replacing the lead service lines. But crucially, because the infrastructure was already so thoroughly destroyed, the lead levels remained completely unsafe for months, even after they switched the water source back. Now, none of this recovery, or the exposure of the truth for that matter, would have happened without some incredibly rigorous scientific and journalistic work. The data we've looked at today is grounded in extensive research from the American Water Works Association, the World Health Organization, and those vital independent studies that forced transparency when the government was trying to hide it. To wrap things up, the Flint water crisis isn't just some dark chapter in a history book. It is a massive, enduring lesson in environmental management, environmental racism, and public health justice. It asks us all a really fundamental question. What happens when we view essential human infrastructure as nothing more than a line item on a budget? The distrust in Flint lingers to this day, a whole decade later. So will we let this happen again, or will we finally learn the lesson? Thanks for exploring this incredibly important topic with me on The Explainer.